Hello and welcome to All This Science, the science podcast that describes an interesting aspect of science in 5 minutes or less. My name's Cam, and I'll be your guest for this episode. Today's episode is about malignant hyperthermia. Malignant hyperthermia, or MH, is a genetic disorder of the skeletal muscles, involving a hypermetabolic response to halogenated anesthesia and/or a paralytic known as acetylcholine, both of which are used during surgery. According to Dr. David S. Beebe of the American Society of Anesthesiologists, the frequency of an MH reaction occurring ranges anywhere from 1 in 10,000 to 1 in 250,000. It is possible for MH patients and anesthesiologists alike to never encounter an MH reaction. An MH reaction is ultimately caused by a malfunction of the calcium channels in the sarcoplasmic reticulum, causing an uncontrolled release of calcium ions into the skeletal muscles. The outward symptoms of an MH reaction are as follows: an excess of CO2 in the bloodstream, known as hypercapnia, the uncontrollable contraction of muscles, known as muscular rigidity, masseter muscle spasms, which is also known as jaws of steel, respiratory acidosis, which is the increase of acidity in the bloodstream due to hypercapnia, cyanosis, which is blue-tinted skin, tachycardia, an abnormally high heart rate, hyperkalemia, which is high potassium levels, rhabdomyolysis, the death of skeletal muscles, hyperthermia, which is the extreme rise in body temperature. Without treatment, an MH reaction is guaranteed to be fatal. Heat and exercise have been shown to cause minor MH symptoms in patients, according to the Malignant Hyperthermia Association of the United States. Due to personal experience regarding this disorder, I know of the preventative measures that can be taken to ensure the probability of an MH reaction occurring in the operating room is at an all-time minimum. An at-risk patient will often be the first case of the day. At-risk patients will be brought to a different operating room where equipment specific to MH cases are used to ensure that there is little to no possibility of an encounter with an MH triggering agent. In addition, the patient will be segregated in the recovery room so that there's no inhalation of the anesthesia other patients will be off-gassing. They will also be monitored for a longer amount of time to watch for any possible symptoms of a reaction. Treatment of an MH reaction includes a number of factors. Discontinue volatile anesthesia use and do not administer acetylcholine. 2.5 mg/kg of intravenous dantrolene every 5 to 10 minutes to reduce muscle rigidity and acidosis. Intravenous sodium chloride until body temperature reaches 38.5 degrees Celsius. Treat any arrhythmias and hyperkalemia without using calcium channel blockers, or things could be made worse. Ensure urine output of 2 milliliters per hour as needed. And 24 to 48 hour observation, re-administering 2.5 mg/kg of dantrolene if symptoms were to reoccur. According to the U.S. National Library of Medicine, there are at least 217 mutations in the RYR1 gene that are known to increase the risk of MH. The RYR1 gene, or ryanodine receptor 1 gene, form the channels that control the release of calcium ions into muscle cells, playing a critical role in muscle movement. MH in humans is autosomal dominant, meaning if a parent or sibling has the MH mutation, then you have a 50% chance of having the mutation as well. MH has also been found to affect pigs. Testing for MH is done most commonly through a muscle biopsy from the thigh that is injected with concentrations of halothane and caffeine. If the live muscle has an exaggerated response, then the patient is considered to be MH susceptible. This is usually a last resort, as the amount of muscle needed to test for this condition tends to leave an aesthetically unappealing scar on the body. Oftentimes, before this test is done, an at-risk patient will go through a consultation with the Department of Genetics, specifically metabolics, and the Department of Anesthesia to assess risk and trace family history through genetic mapping via DNA testing. All in all, malignant hyperthermia is an extremely rare condition that's both fascinating to study and terrifying to think about. Thanks for listening to All This Science. Contact us at allthisscience@gmail.com if you'd like.